In this video, we will study about a case presentation of rotator cuff tear. My name is Dr. Ume Aman and welcome back to my YouTube channel. And if you like the video, then please do comment and subscribe. सबसे पहले हम देखेंगे इस वीडियो का कंटेंट क्या है। आज हम देखेंगे rotator cuff tear, a case presentation. First of all, we will study about introduction, then case presentation, history taking, its treatment plan, and then we will go for follow-up and discussion. Introduction. Disorders of the shoulder are extremely common. Almost 30% of people experiencing shoulder pain at some stages of their lives. For people over 65 years of age, shoulder pain is the most musculoskeletal problem that is common. In addition to the high incidence, shoulder dysfunction is often persistent and recurrent, with 54% of sufferers, and ongoing symptoms after 3 years. Pathology of rotator cuff and subacromial bursa are main causes of pain. सबसे इम्पॉर्टेंट हमारे पास शोल्डर पेन को जो कॉज करते हैं दैट इज़ रोटेटर कफ एंड सब एक्रोमियल बर्सा, और मोस्ट कॉमनली हमारे पास 30% पीपल एक्सपीरियंस करते हैं ड्यूरिंग देयर लाइफ टाइम्स. नाउ वी विल सी केस प्रेजेंटेशन. The patient was a 53-year-old man who was suffering from a moderate pain in his right shoulder because of lifting a heavy object. 2 days after the incident, due to falling on an outstretched hand while climbing, he felt a very severe pain in the same area. अब हम इसकी हिस्ट्री देख लेते हैं. डेमोग्राफिक प्रोफाइल, नेम, एज, रेफर्ड फ्रॉम, एड्रेस एंड डायग्नोसिस. प्रोविजनल डायग्नोसिस एंड डिफरेंशियल डायग्नोसिस हमारे पास इस पेशेंट के बनेंगे. रोटेटर कफ टीयर, दैट इज़ प्रोविजनल डायग्नोसिस, एंड differential diagnosis may be adhesive capsulitis and supraspinatus tendinitis. Chief complaint involves pain in right shoulder 3 days back and restrictive movements 2 days back. सबसे पहले उसे पेन स्टार्ट हुआ राइट शोल्डर में 3 days बैक, और उसके बाद उसने उसकी मूवमेंट्स को इन्वॉल्व किया 2 days बैक. अब नाउ हिस्ट्री ऑफ प्रेजेंट इलनेस उस पेशेंट की क्या है. माई पेशेंट वॉज इन यूजुअल स्टेट ऑफ हेल्थ व्हेन ही गॉट पेन एंड रिस्ट्रिक्टेड मूवमेंट्स ऑफ राइट शोल्डर 2 days बैक. ही वॉज अ स्पोर्ट्समैन. While climbing, he felt severe pain due to carrying a heavy object and falling on an outstretched hand. These are the main reasons of his illness. Now the aggravating factors जो कि उसकी पेन को इंक्रीज़ कर रहे हैं, these are movement at right shoulder. जब भी वो मूव करता है उसे पेन आता है. And the alleviating factor is rest. Past medical and surgical history was nil. He was all right. Investigations that were done was serum calcium and vitamin D analysis. Diagnostic imaging हमारे पास क्या शो करती हैं. On ultrasonography there was a complete tear of supraspinatus tendon and other cuff tendons are suspicious. On MRI, there was no rupture of other tendons, but there is some sort of fluid presence. Neurological, musculoskeletal and vascular, but pain indicating that there is a musculoskeletal system issue. Other systems जो इनका analysis किया गया that were cardiac, urology and digestive system. But these were all right. Now move to the clinical examination of the patient. सबसे पहले पेन असेसमेंट, कंपैरिजन ऑफ बोथ अपर लिम्स. पेन इन राइट शोल्डर ऑन विजुअल एनालॉग स्केल वाज 9 out of 10. दैट इज़ severe पेन. रेंज ऑफ मोशन मेजरमेंट विद गोनियोमीटर. गोनियोमीटर इज़ एन इंस्ट्रूमेंट दैट इज़ यूज्ड टू मेजर रेंजेस 150 degree flexion, 130 degree painful abduction, painful internal rotation. Other movements are normal. Left shoulder was perfectly normal. टेस्ट फॉर शोल्डर, राइट शोल्डर के लिए हमने जो टेस्ट परफॉर्म किए हैं दैट आर नियर इम्पिंजमेंट साइन, एम्प्टी केन टेस्ट, हॉकिंस नेडी टेस्ट एंड स्पीड टेस्ट. दैट विल इंडिकेट दैट शोल्डर इज सफरिंग फ्रॉम रोटेटर कफ टीयर और एडहेसिव कैप्सुलाइटिस. All tests are positive for right shoulder. Neck evaluation was normal, range of motion was normal, and there was no pain. Posture evaluation indicates that there was a thoracic and kyphotic posture, forward head posture, right scapular winging, tightness in right upper trapezius and levator scapulae. Then we did neurological examination that indicates that patient was alert, conscious and oriented. अब हम मूव करेंगे फिजिकल थेरेपी ट्रीटमेंट प्लान की तरफ. फर्स्ट 2 to 3 days में वी डिड नो ट्रीटमेंट, only with manual massage. We treated patient with manual therapy. Patient had taken meloxicam 15 mg twice a day for only 3 days. After first visit, 10 sessions of physical therapy modalities, TENS, ultrasound and superficial heat every 2 days, each session for 45 minutes. एक्सरसाइज प्रोग्राम हमने जो डेवलप किया था दैट बिगिन आफ्टर 5th सेशन ऑफ फिजिकल थेरेपी मोडालिटीज़ 2 weeks आफ्टर इंजरी इन फर्स्ट मंथ ट्वाइस पर वीक. फर्स्ट फेज़ ऑफ एक्सरसाइज प्रोग्राम हमने क्या दिया था, दैट इज़ पैसिव रेंज ऑफ मोशन, जिसमें फ्लेक्शन, इंटरनल रोटेशन, एक्सटर्नल रोटेशन एंड एबिडक्शन आ जाता है. पेंडुलम एक्सरसाइजेज, आइसोमेट्रिक एक्सरसाइजेज एंड श्रगिंग ऑफ शोल्डर आ जाता है. ऑल ऑफ दीज आर डन 20 to 25 times daily. Stretching exercises for posterior, anterior and inferior capsule twice daily. 5 repetitions and 5 seconds hold. Now move to the second phase of exercise program. Strength training was initiated from second month और उसके बाद हमने स्कैप्शन एक्सरसाइजेस करवाई हैं. स्कैप्शन एक्सरसाइजेस हमारे पास इन्वॉल्व करती हैं 0 to 30 degree abduction movement and internal external rotator strengthening exercises. After 3 weeks, strength training and stretching of neck were conducted. This was second phase of exercise program, and now move to the third phase of exercise program that involves strength training of periscapular muscles, wall push-ups, wall push-up with ball, 3 sets, 10 repetitions. Cuff strength training intensity was increased gradually, 3 set, 15 repetitions. At the end of 6 months exercise program, patient's pain reached to 0 degree according to visual analog scale. Near impingement sign, empty cane test, Hawkins-Neddy test and speed test are negative on evaluation. However, winging of scapula persisted. Abduction is 146 degree and 170 degree flexion in right shoulder. Ultrasound showed no difference compared to the time before treatment. On follow-up, we found out that 3 years after treatment, in order to study lasting effects of conservative therapy. Discussion results suggested a very satisfactory improvement in pain and movement restrictions at shoulder joint. Patient's compliance was excellent throughout the treatment. He cooperated well during his therapeutic session. And this was all about a rotator cuff tear case presentation that we can manage through conservative therapy. And it was an evidence-based